Title: A Mother's Body, How Much Can It Truly Bear? What happens to a woman's body after the first, second, and third delivery? And how many children are enough for a woman to stay healthy? Did you know that your body ages by 9 years biologically after just one child? And if you become a mother 3 times, that aging can spread to your heart, brain, and bones. So the real question is, when should you become a mother? Welcome to my channel. You're watching Health Bridge Europe, your very own channel. We are committed to your health and well-being. So, let's begin with today's important topic, a valuable secret directly connected to your health. How many times? And with what gap, so your body, heart, and life remain safe and whole? Today, we will answer all these questions through the lens of science, the depth of emotion, and the truths of European medicine. Part 1. The First Pregnancy. A woman's body on the edge of new life. The first delivery is a revolution for a woman's body. According to European research, especially by Cambridge University and the European Institute of Maternal Health, pregnancy is not just a reproductive event, it's a neurological transformation. European Journal of Neuroscience. After the first delivery, estrogen levels drop dramatically, pelvic muscles weaken, calcium depletes from bones, emotional highs and lows appear, postpartum fatigue, sleep loss, and mental overload set in. However, if a woman is between 20 to 30 years of age, the body is stronger, recovery is better, and overall health impact is lower. Part 2. The right age. When is the best time to become a mother? Institutions like WHO UK and ESHRE, European Society of Human Reproduction, agree the safest and most beneficial time for a first pregnancy is between 20 and 30 years of age. Why? 1. Egg quality is optimal. 2. Skin, bones, and uterus are more flexible. 3. Pelvic muscles are stronger. 4. Lower risk of miscarriage, C-section, and complications. But as a woman nears 35, egg count and quality start to decline. Risks like Down syndrome, gestational diabetes, and high blood pressure increase. Recovery becomes slower. Becoming a first-time mother after 35 is not a marathon. It's a survival challenge. Part 3. Second pregnancy. Double the load. By the second pregnancy, the body has already carried the weight once. If the gap is insufficient, less than 18 to 24 months, risks multiply dramatically. According to Mayo Clinic, during the second delivery, iron deficiency, pelvic organ prolapse, and postpartum depression become more likely, especially with short gaps. After the second delivery, pelvic floor weakness doubles. Back pain can intensify. Bladder leakage and uterine sagging are common. Calcium depletion increases. European doctors advise, second pregnancy requires full physical, emotional, and nutritional recovery. If the gap is short, each pregnancy can cause lasting damage to the mother's body. Part 4. Third delivery. Does the body start to wear out? This is the stage where the body begins to tire, especially if all 3 deliveries are closely spaced or if the third occurs after age 35. After the third delivery, a woman's body can biologically feel 10 years older if proper care isn't taken. Common issues that arise: joint pain and decreased bone density, thyroid and hormonal imbalance, sexual discomfort, chronic fatigue and brain fog, emotional disconnect from self. Part 5. Why gaps between pregnancies are essential. A gap of at least 18 months, ideally 2 to 3 years, is essential before the next pregnancy. Why? The uterus gets time to fully recover. Nutrient levels in the body are restored. The mother gets a mental and emotional reset. The next baby is healthier. The uterus is like a field. It needs time to restore before you sow another seed. Dr. Eva Lund, Swedish gynecologist, Part 6. How many children are right for a healthy life? This is an emotional question, but needs a medical answer too. According to European experts, 2 children are the balanced limit. A woman becomes a mother and preserves her health. 3 children are possible if nutrition, gap, and care are adequate. 4 or more require continuous medical and nutritional monitoring. A woman's longevity, mental health, and physical strength remain stable when she has 2 to 3 children and completes deliveries before age 35. Part 7. Europe's approach. How women care for themselves. 1. France. Average of 2 children. Every mother receives pelvic physiotherapy after delivery. 2. Sweden. 480 days of paid maternity leave. Complete mental health assessment during every pregnancy. 3. Germany. Special dietary supplements during pregnancy. Free rehabilitation clinics post-delivery. 4. Italy and Spain. Late marriages, but first pregnancies mostly at 28-30 years. Egg freezing is a common service, so women can become mothers at the right time. Conclusion: a mother's body is not a machine. A mother doesn't just give birth to a child. She recreates herself every time. Whether it's the first, second, or third delivery, each time she loses a part of herself. Bone strength, peaceful sleep, skin freshness, heart's calm, and sometimes her own identity. But if she knows when to become a mother, how many times, and with what spacing, she can protect herself. Dr. Marianne Grosset, a gynecologist from France, says, "A woman doesn't lose herself in motherhood if she learns to protect herself before it begins." Final message. If you're a mother or planning to become one, don't just ask others, "When should I become a mother?" Ask yourself, "Am I ready? How will I protect my body, my heart, and my life?" Because a healthy mother is the foundation of a healthy generation.